A new and highly potent drug may be emerging right here in South Carolina, raising concerns from both local and national experts. And Richland County's very own coroner says she found the drug during an investigation into a woman's death. Right now, investigators are working to determine, though, how dangerous this drug could be. News 19's Kiki Gushu is reporting tonight.
So when we saw cyclorphine and they called us, we were just in shock. Like, this doesn't happen in our state. We haven't seen this. We see it in Tennessee. We see it in Oklahoma. We don't see it in South Carolina. And as far as I know, right now, we're the only agency that has had a positive result like this.
It started with a death investigation case in Richland County that didn't make sense. A suspected overdose, but no drugs showing up in the woman's toxicology test results. Richland County coroner Nita Rutherford says that's when SLED investigators took a closer look at a powder found at the scene of the death.
Just because someone tests negative on their toxicology panel does not mean that they don't have substances in their system. It just may be that the testing that was done did not detect that particular drug.
Rutherford says that decision led to a critical discovery.
So when we saw that this person did not test positive, we sent the sample that we had, and that's how we came up with the cyclorphine.
What investigators found was cyclorphine, a new type of synthetic opioid. It's designed to act like other opioids, such as fentanyl, but may be even stronger.
That is 10 to 40 times more potent than fentanyl.
Experts say this is part of a growing shift in the drug supply. Addiction medicine specialist Dr. Rachel Virginis says new synthetic opioids are beginning to replace others like fentanyl.
We've started to see this shift to newer or different synthetic opioids.
And that shift makes these drugs harder to detect.
Fentanyl test strips don't detect anything that's not fentanyl.
Meaning people may not even know what they're taking.
Expect that pills, if they're not from a prescribed source, not from a pharmacy, expect that they are counterfeit.
And even life-saving treatments may need to be used differently.
Maybe one spray of naloxone or Narcan is not enough. And so that's something that we can expect to see with cyclorphine too.
Rutherford fears this discovery is just the beginning. They're now reviewing other undetermined deaths to see if this drug may have been involved.
I am terrified that we're going to see more of it because such a small amount can cause an overdose.
Research into cyclorphine is still in the early stages, as experts try to learn how it behaves in the body and why it's so potent. In Columbia, Kiki Gushu, News 19, WLTX.
Wow, Kiki, thank you so much. And Rutherford says that families should go ahead and have Narcan on hand. It is available throughout community distributors, including the Richland County Coroner's Office, with no questions asked. And of course, we're going to have more stories or more information on this story over on WLTX.com.